Why is airway resistance important for lung function? Imagine trying to breathe through a narrow straw versus a wide-open pipe. The difference in effort is huge, and that's what airway resistance is all about. It's the opposition air faces as it moves through your respiratory pathways. When you breathe in or out, air travels through your nose, throat, windpipe, and smaller tubes called bronchi and bronchioles. The ease or difficulty of this flow depends on how wide or narrow these airways are. If the airways are narrow, resistance goes up, making it harder for air to pass through. This means your respiratory muscles have to work harder to get enough air into your lungs. When resistance is high, breathing feels more effortful, and you might tire out quicker. That's why conditions like asthma or chronic obstructive pulmonary disease, which cause airway narrowing, make breathing more difficult. The size of the airways plays a big role in resistance. Small decreases in diameter can cause large increases in resistance. Think of it like squeezing a garden hose. A tiny pinch can drastically reduce water flow. During normal breathing, the elastic tissues around the airways stretch when you inhale, helping open the tubes and reduce resistance. When you exhale, especially forcefully, the airways can narrow due to dynamic compression, increasing resistance again. This fluctuation is normal but can become problematic if the airways are already narrowed or obstructed. Airway resistance also influences how evenly air is distributed in the lungs. If some parts of the lungs have higher resistance, less air reaches those areas, leading to uneven ventilation. This can reduce how effectively your lungs exchange gases like oxygen and carbon dioxide. Measuring airway resistance helps doctors understand lung health. Tests like plethysmography or forced expiratory volume tests show how much resistance there is and if airflow is limited. In the end, airway resistance is a key factor in how well your lungs work. It affects how much effort you need to breathe, how evenly air reaches your lungs, and how efficiently gases are exchanged. Understanding this helps explain normal breathing and why certain diseases make it harder to breathe. It's all about how the structure and condition of your airways influence your ability to take in fresh air and get rid of used air.